And hello, everyone. I'm Professor Jennifer Harrison-Hauer, and this is your Weeks 2 lecture, concept recording. Let's get started. I'm going to share my screen, and let's begin with chapter 20. Hope everyone had a restful weekend and ready to start the week. Okay, you guys. So our chapter 20, Family Development, Family Nursing Assessment in Genomics. It's a pretty interesting chapter here, and let's get into a little bit more into detail. You always have your objectives, so you guys make sure you read and understand your objectives. After your readings, just review them again and just make sure you have a solid understanding of that chapter's objectives. So going into family nursing, the trend in the delivery of healthcare has been moving more towards healthcare in the community setting. Thus, family nursing is very pertinent to nurses in the community health setting. And so the family defined consists of nurses and families working together. So you're working together with members of that family to provide health education, social services, whatever is needed so that family can be as healthy and as whole as possible. So public health nurses, if you're in this type of specialty nursing, you want to be comfortable moving from working with individuals at the bedside to families and seeing that family as your one cohesive unit that you're working with. You want to continue to bridge with their relationships and working with families and communities and get in the mindset that you're not at the bedside, you're working with individuals oftentimes in their homes. And so there are challenges, of course, that goes with any type of nursing that we do, and you guys will realize that as well. Challenges can be overcome when you have that information so that you can, do the best that you can with resources that you have. So the definition has changed from your traditional to, and it's not really a single defined, agreed upon definition. So what you may see as a traditional with mom and dad may look completely different, and that can be their family, which is perfectly acceptable as well. So nurses are responsible for helping families promote their health, meeting their needs, coping with any health problems that may arise within the context of the existing family structure, in collaboration with families to develop useful interventions. So you're working with them to lead the best possible life that they are able to. So nurses are often the link. We are that gel, that glue between the family and the services that they need. So you'll come across being as their advocate, helping them to get the services that they need to live the best life that they can. So the family functions are the ways in which the family meets their needs. So how do they meet their needs of their unit? Each family member, the family as a whole, and their relationship to society, all of those things will come into play. So when you're looking at this actual family structure, it refers to how the characteristics and demographics, like the sex of the families, the age, the number of individuals who make up the family unit. So you look at that particular makeup, if you will. More specifically, the structure of a family defines the roles and the positions of the family members. So you want to come in having an understanding of that particular dynamic. So the term family health is often used interchangeably with the concepts of like family functioning, healthy families, or family health. So when you think of families, they're neither all good nor all bad. And I just keep that in mind, no judgment and that sort of thing. Therefore, nurses need to view the family behavior on a continuum of need for intervention. So it's continuing on throughout your time working with them, whatever their need or intervention is at that particular time, and it can change. And when a family comes in contact with the healthcare system as well, look at your box 20.2. Provides a description of healthy families. So just make sure you guys haven't, you review that, of course. And then the 4 approaches to family nursing. The structure, seen as a client, as a system, as a component of society. So as the context of structure has a traditional focus that places the individual first and the family second. So that's one approach. And then as the client, you're considering the family as first and the individuals are second. So you're looking at the family as being coming first, whatever's the good for the family, not that individual person. You can think of the family as a system, which focuses on the family as a client. And the family is viewed as an interacting system, if you will, this living entity system in which the whole is more than the sum of its parts. Simultaneously, your focus is on the individual members and the family as a whole. So just know your definitions. Just memorize your definitions and just start there so you can tell the difference between looking at the family as a structure, client, a system, and a component of a society. The family is seen as one of many institutions in society, along with health, education, religious, or financial institutions. So just know your definitions and understand the differences between the two. And then there is as far as the theoretical frameworks for family nursing, there is no single theory or conceptual framework really that fully describes the relationships and the dynamics of the family, and can be used to understand and intervene with family. Thus, when you think of it theory-wise, it's an integrated approach is necessary because one theory doesn't really fit everyone. And so therefore, perspective does not provide nurses with enough knowledge to work effectively with communities. Therefore, community and public health nurses must also blend family nursing theories with public health theories and frameworks to work both with individual families and population families. So all that says is that you have to, because the family dynamic is so multifaceted, that one theory, one approach really doesn't capture it all and does it justice. That's pretty much what this slide says. So just know that going in. And then looking at genomes, genomics, genetics, the Human Genome Project. The Human Genome Project, I believe back in the 90s, your text does a really good job, of course, explaining all this. But its whole goal, the Human Genome Project, was to determine the sequence of the human genome, which is the complete set of DNA in a human cell. So the information gained from the project has helped researchers to identify genes specifically associated with various diseases. And to develop new treatments, which is always a good thing, and therapies. It has also led to advances in fields such as forensic science, evolutionary biology, and the like. And then continuing on with working with families and having healthy outcomes, because the whole goal is that you want, whatever work you do, you want to come into the family unit when you're working with them and leave them in a better place than how you found them. So there's information you gather beforehand, plan your visit, and design your interventions and so forth, and evaluate to determine what you did was even successful. So then looking at a social and family policy change, hooray for, I remember when the Family Medical Leave Act came out in 1990. This was just phenomenal for families. Family policy is a government action that has a direct or indirect effect on the family, such as, again, Family Medical Leave Act, looking at the different programs for Social Security and temporary assistance for needy families. All of these policies listed was a definite plus for families and help them to, again, any policy that helps them to lead a better life, gives them the resources and tools they need is always a win. So again, Healthy People 2030 in relationship to our families emphasizes individual and community issues. There are some objectives tied to specifically to families and homes. So just make sure, again, for what we're discussing, you're familiar with the Healthy People that's pertinent to what we're discussing. So that concludes this particular chapter. All righty, let's get into chapter 20. You guys still hanging tough with me? Awesome, awesome. Let's get into family health risk. So, again, your objectives, make sure you have a solid understanding after you've completed reading the chapter. So, the family system really is a basic unit within which health behavior, including health values, health habits, what are the habits of the family, what are the risks, perceptions, is really developed, organized, and performed. So you want to come in having an understanding, you'll get an understanding of what is the family's, what is their behavior. Early approaches to family health risk historically has focused on illness, the role of the family in the cause of the disease, and the role of the family in its services. And then the health of the nation increased, eventually over time, increased in attention to improving the health of everyone in the United States. There are different studies that are discussed in your chapters. But you would be looking at specifically concepts in family health risk. Look at the family health. So it's a condition including the promotion and the maintenance of physical, mental, spiritual, and social health of the family unit and for individual family members. So the health risk, these specifically, we want to understand what health risks are. What are the factors that determine or influence whether disease or other unhealthy results occur? Know that definition. Then health risk appraisal is the process, it's a process of identifying, analyzing an individual's prognostic characteristics of health. So you're analyzing what is their understanding their health and comparing them with those of a standard age group. So it's an analysis, and therefore providing a prediction of a person's likelihood of prematurely developing that said health problem that has associated high morbidity and mortality in the country. Know your definitions. So health risk reduction, what you want to do is when you apply said interventions to control or reduce risk factors, that's what you want to do, and minimize the incidence, new cases of associated disease and premature mortality risk reduction is reflected in greater numbers between appraised and achievable ages. Just know these definitions. You want to reduce risk. You want to leave folks in a better condition. So life event risks are age-related risks to a person's health that often occur during transitions from one developmental stage to another. It's like when a woman goes from premenopause to menopause. They tend to have a higher increase of osteoporosis. Family crisis is a situation whereby the demands of the situation exceed the resources. Oops, you guys went further. Exceeds the resources. Let me just back up. So a family crisis is any situation whereby, The demands of the situation exceed the resources that that family has and the coping capacity that they have for that particular event. And then the Newman's model, the Newman system models, was an excellent theory that started out or was created by Newman, I believe your chapter says. So what I love about this model is, well, any approach that's holistic in nature, holistic systems-based approach to nursing, okay? So it's for us that views the individuals as being constantly influenced by internal and external stressors in their environment. So the model is based on the following core concepts: that the individual is viewed as a whole system composed of interrelated parts. So we're not just looking at physical, we're looking at the social aspects of the person, the spiritual aspects of the person, all of these different things, and how that person interacts with the environment is that person constantly exposed to stressors. So it's a holistic approach of viewing the individuals. So then again, physical, social, psychological. So when you're looking at that individual person, don't look at the fact that they have diabetes, looking at all of those different factors associated with it, with that individual when you're looking at their health. And so health risk, those factors that determine or influence whether disease or other unhealthy results occur are called health risk. Know that definition, okay? And then the major family health risk and nursing interventions are listed here for you. They discuss inherited biological risks. So what are your genes? You gotta know what's in your genes. Things that are controllable and not controllable within your life. Environmental risks, socially, behavioral, what are the health habits and lifestyles that put that individual at a risk. So when you're going out to your home visits, you want to give a more accurate assessment than you do in your clinical visit. So keep that in mind of the family structure. So give a more accurate assessment than when you're doing a clinical visit of the family structure, the natural or home environment. Look at everything, the behavior, what's going on in that environment. And so when you're contracting with families, okay? So that means that picture there is that you're working with that individuals, involves a shift in responsibility, okay? And control towards a shared effort by the client and professional rather than by the professional alone. So it's teamwork here. You're empowering families. And I enjoyed my time as a public health nurse. I felt like I could do the most when I'm out there in their homes as a welcome guest. And it's a great relationship. Vulnerable populations are at risk listed here for you as well. So if you come in contact with individuals from different backgrounds that's listed there, teen parents and what have you, know that they have unique challenges that you want to be aware of and to work together with that individual. So community resources, I cannot stress enough and underscore the importance of having, if you guys decide to do community health, you want to have a plethora of resources so you can connect your families to, from WIC to teen parenting programs. It's listed, it's not even complete. There's so many different resources. That goes without saying. So you want to be there because it's going to take a village approach to working with your families and having the resources available to help them live healthier lives. It's what it's about. So community resources, you want to locate and use these resources often requires skills and patience that many families lack. So that's where you come in your partnership with them to help arrange for transportation, get them the information, get them to make the initial contact with a specialist or what have you. So moving on. Okay. Let's go into chapter. Let's see, 22. Okay. So let's look at health risk again across the lifespan. Objectives for your chapter. So this chapter emphasizes health status, leading causes of death, and the like. So nurses who are working in the community, you're using a population-centered approach. Again, you're looking at individuals within that community. You're looking at the approach can have a significant influence on your teaching of individuals of all ages. So you have to be able to go from working with children to elders if they're in the house, and how to increase their health promotion activities by reducing their risk for disease and disability and living healthier, longer lives. So for children, the major public health concerns are listed there for you. Just because they're children doesn't mean they're not without their own concerns. Obesity, injury prevention, child maltreatment, and the like. So your areas of prevention listed here for you. These are your targeted areas, means you want to focus on these guys as well. And listing different policies. So everything has policies and trends that have evolved over time. So in the 1965, there was a focus on Older Americans Act. And you see it continues on with 1993, where we had the Family Medical Leave Act, for example. Mothers can take up to 12 weeks, and the fathers as well. Parents, extended family medical leave and the like. So policies have evolved over time, and they will continue to evolve over time as the need arises. So ethical and legal, especially with your older adults, there's always decision-making. You want to involve your clients in their decisions of their life. And if they lack the ability, there are appropriate surrogates in place, but you want to involve the individual and their families, and realize that elders also are at risk for abuse, and then there are National Centers for Elder Abuse hotlines out there. So major health issues and chronic disease management. With chronic disease, the focus is on healing. It's a unique process resulting in a shift of the body, mind, spirit system. Rather than curing, you're looking at elimination of the signs and symptoms of disease. So the goals for chronic care are listed there for you. So it's a prevention of complications, diabetes, and amputations and kidney failure and the like. So again, health status indicators for chronic disease are listed there for you. Hypertension, stroke, diabetes. And continuing on with chronic disease specific for women, for example, reproductive health, and as we go through menopause and breast cancer, there's unique issues for women, for children, for elders, for men, such as prostate cancer, different issues that are specific for your for men and women and children. And then when people of color as well, incarcerated individuals, your frail elderly, they're your special groups of adults. So that you can be cognizant of if you have individuals from a lesbian background or frail background, frail elderly, that there are unique health disparities that you need to make sure that you are aware of and connect with resources that are needed for everyone to live their best and healthiest. And then therefore community-based. So if you're working in an assisted living or adult daycare center or the like, there are unique challenges for that population as well. And then we're moving into our final chapter. And let's get into our chapter 31. Okay, you guys, thank you for hanging tough with me. So let's get into the nurses in the school, another subset of community public health nursing that I personally love. Well, I've all over it, but anyway, the objectives, again, have a solid understanding. So this chapter really discusses the history of, goes a little bit into the history of school nursing, examines the evolving roles and activities of school nurses over time. Frameworks for evidence-based school is discussed. Practice will be explained, and we go into the impact of federal regulations and the like. So then the history of school nursing is this one slide kind of accident for us here. Federal regulations that started in the 73s, there are different disability acts, No Child Left Behind, and Healthy, Hunger-Free Children, different policies and focuses over time. And then we have the standards of practice. So there are standards for occupational nursing, school nursing. There's a national standard of school nurses that they follow, and the different standards of professional practices that they follow as well. And then they actually have to have certain educational, so nursing, registered nurse, and then credentialing certifications that they need to make sure that they have as well to show that they have the basic standards in place to be a school nurse. There are no general laws regulating education background of school nurses. Majority of them are registered nurses. There are assistants and what have you, but there are usually a registered nurse that covers a particular school, and then she has aides that work underneath her. So therefore, they give comprehensive nursing care to children. So think of it, well, it is specialty nursing, public health, community nursing for that school. They work in conjunction with the school officials. They coordinate the care of children with special needs. They wear many hats. They can be your consultant, your counselor, your health educator. All of us remember school nurses because we had them in our schools, and had fond memories of my school nurse. So the Federal School Health Services, CDC's Healthy School Initiative, considers the whole school, the whole community, the whole child model. Again, that holistic approach is what the CDC's role is for the federal nurses. And then again, Know Your Healthy People 2030 as it relates to this particular chapter we're discussing to school nurses. So there's several objectives that are listed there, directed specifically for the care of children in schools. And so going on to the levels of prevention, look at your figure 31.2, I believe, prevention levels in schools. And that's what this particular slide discusses, disease prevention education, reducing playground injuries. And then again, looking at the secondary prevention in schools, such as nursing care for emergencies, and tertiary, looking at your children with chronic conditions, your allergies, your asthma, your diabetes patients, children, managing those children that are homebound as well. And then there is controversial issues in every area of nursing, and school nursing is certainly not immune, such as birth control and giving birth control in schools. Ethics specifically to school nursing, you're looking at how if the nurse feels strongly about a certain situation, how they would handle that, how they would refer to other health providers when there's sensitive issues involved, let's say with pregnant teens or what have you. So the future trends in school nursing, it is a wonderful area of nursing. If you're interested in working in pediatrics, where you have the same patients every day and you get to know the families, you get to know the children, of course, certainly an area of nursing that is definitely beyond a feel good, but also you're helping your future leaders, your future nurses, if they decide to be nurses. You're helping children, you're their advocate, you're their confidant as well. So definitely an area, especially area of nursing that just keeps on giving. And that, you guys, I will stop sharing. That concludes our week 2 concepts lecture. Make sure you complete your readings, review information for the week. Come to class Friday, 9 a.m. Eastern time, and we'll see you then. Thank you so much, and enjoy the rest of your day.